Hello, everyone. Hi, everyone. Thanks for joining us. I'm Laura Scapitici. I'm the Director of Programs from the Anthroposophical Society in America. Thank you so much for being here with us with Dr. Renee Meyer. The title of our presentation tonight, which is part of a medical series on the challenges and spiritual gifts of aging, is Movement, Will, and Bone. So thank you all for joining us. And what I'd like to ask you to do as you come on is if you could please just type into the Q&A. There's a little Q&A box if you move your mouse around, and let us know where you are in the world so we can connect with you. I'm up here in Northern California. And Renee, you want to say hi and tell everybody where you're at?
Yes, hi everyone. I'm in Charleston, South Carolina.
That's great.
Yeah.
Okay.
You may hear a little meowing in the back. That I'm at my daughter's house, and there is a 3-week-old kitten who's dying to be part of this, but later.
Oh, that's so sweet. Well, I have a kitten in the room too, so who knows what will happen while we're doing this webinar today. Okay, I've got David from San Francisco, Elena from Berkeley. Let me see who else. Hi, Michelle is here from Sacramento. So glad you're here. Hey, anybody else that wants to type in where they're calling from, that'd be super. We'd love to hear from you and get to know where you're at. So I'm just going to give that one more moment. See if anybody else joins in. Okay. All right. Well, thank you everybody for being here, and thanks to all of you who are tuning into the recording too after the fact. And we just had Robin from Atlanta join us too. So we've got the span of the country happening here. That's fantastic. Thank you. All right. So I thought I would just take a minute to introduce you, Renee. It's been just so lovely getting to know you doing this work, and such an interesting platform to work on when we're doing webinars like this and to get it all going. So I really appreciate you being here. And I just wanted to say a little bit about some of your focus has been on chronic health issues, which I think is so important to be working with right now. So thank you so much for doing that work in your private practice and through Anthroposophical medical perspectives. That's really fantastic. So thanks again. And I think I can just turn it over to you and we can go from there. How's that sound?
Sounds good to me.
Great. Thanks.
Well, hello everyone. My title is Movement, Will, and Bone, and I hope I can live up to that title with what we talk about tonight. But my hope is that I can bring a little bit of an anthroposophic approach to osteoporosis and actually to medical conditions in general into view. So here's hoping. So I guess about a couple of weeks ago, we were at a baseball game, and the children in front of us got up and started to dance. And they had these beautiful, flexible, quick movements. Their spines were directed in every potential position and posture. And when you looked at older people walking around, they are often rigid and fixed in position. So you might wonder what happened to the spine. Why did it become so rigid? Well, many things, depending on the actual condition. But one of the things that happens is that the life substances in all organs start to recede from organs, and they're replaced by inorganic substances like calcium or scarring. So I thought we could explore the spine a little bit and consider the unique qualities of the human spine, and also relate this to anthroposophic principles.
That's great, Renee. And I'm just going to ask if you can move up or tip your computer down a little bit because your name is nice and big in the corner. That's perfect. Thank you. I want people to be able to see a little bit more. Thanks. That's great.
Okay.
Thank you.
So Rudolf Steiner gave us this profound principle of human threefoldness, in which all the organs, the organs in the body are divided into these 3 systems, and they not only show you the goal of each system, but they also relate to the special human attributes of each system, that is thinking, willing, and feeling. So looking at the nerve sense system first, that comprises the brain, the spinal cord, and all the nerves that exit from the cord, as well as the senses, the eyes, the ears, the nose. What's remarkable about the nerve sense system, first of all, it is going to be the thinking attribute, no big surprise, and it's very symmetrical. The brain is symmetrical, the spine is symmetrical. There are pairs of spinal nerves that come off of the spine all the way down and then are distributed in the body. The eyes and ears and the nostrils are symmetrical. Things are kind of quiet in the central nervous system, as you well know. There's not a lot of vitality. If you have an injury to the nervous system, it generally doesn't heal completely. Sometimes you're lucky and it does, but generally if you've had a stroke, you'll have an initial improvement as the area around the actual nerve damage starts to get its regular proportions back, but the nerves usually continue to have some kind of injury. On the other end of things is the metabolic system, and there things are wildly disorganized. Everything is moving down there, roiling around. There's a lot of heat production. It's very lively. Cells in the metabolic system are continuously reproducing, dying off, and being replaced. A lot of healing going on, no consciousness. How different from the nerve sense system. There's virtually no consciousness in this area. And the metabolic, and that also involves the limbs. The metabolic limb system is involved in the attribute of willing. That is, if you can imagine how much unconscious will is associated with transforming food into human substance. A lot of will energy in that direction, and also the will in moving through the world with your limbs and performing deeds, I think is a little bit more clear as a will force to us. In the middle is the rhythmic system, which is heart and lungs. Again, they have some degree of symmetry, but not complete. For instance, the right lung has 3 partitions, the left lung only 2. The heart clearly is not terribly symmetric. Very rhythmic though in their activity. The diaphragm is also part of the rhythmic system, and they mediate between the others. An example of this would be that if you have a fever or if you exercise, both your heart rate and your respiratory rate, so your lung movement, increases. And the point of that is to not only make more circulation, the products of circulation available throughout the whole organism, but also to be able to eliminate toxins that are accumulating via the breathing and also via the circulation through the kidneys. So there's this mediating quality going on with the heart and lungs. So where does the spine fit in? The spine is deeply involved in threefoldness, and it is, of course, in the rhythmic system. It's in the middle, right where they are. So the rhythmic system is really lungs, heart, diaphragm, and spine, including the ribs in front. There is some symmetry, quite a bit actually, in the spine and in the ribs. And it does mediate through circulation in lungs. And maybe I can explain this a little bit. When you take a very deep breath, your chest expands, that would be your rib cage. Your back moves, your spine moves backward, so there's more room in there. And that allows the lungs a deeper expansion. It also creates a negative pressure in your thorax, and so there's greater blood flow coming in. So that is a way in which the very size and the movement of the ribs and the spine can affect how much blood is being circulated through the center of our being. Because of the fact that the spine is attached both at the shoulders and at the hips to the limbs by muscles and tendons mostly, it is indeed sort of the place where a limb movement can originate. And if you don't believe that, just have a hurt hip. Walking is out, you know, so, or even a low back. Walking is out. So it is the center for limb movement. And when you think about it, it is also functions in the central, in the nerve sense system by protecting the entire spinal cord along its entire length, as well as protecting, of course, the lungs and heart by this cage, this enclosing cage of rib and spine. So the rhythmic system, in short, the rhythmic system, the rhythmic system. This is a little picture, a sketch of the great regularity of the spine. You can see here the spinous processes, all the vertebrae lined up, and of course the ribs themselves are very symmetrical. So Rudolf Steiner gave us this threefoldness, which is organs in certain locations connected to certain human attributes, thinking, feeling, and willing. But there's another type of division and description that he gives to us that makes us go more deeply into the forces of life itself, and that is the fourfold human. So these, this fourfoldness are forces that are invisible, they are imponderable, they weigh nothing, and therefore are spiritual. And they permeate our body, they enhance our physiology, and they connect us to the divine. There's a physical body, which is what we see, and it is subject to natural forces, to the same scientific forces that are out there for all the other substances on the earth. Then the etheric, I put the bodies in quotes because to me, the etheric body, it's really a force. It's only a body if you're clairvoyant and you can see it, you know, in power, surrounding our physical form. But for most of us, it's a force. This force has to do with life, with reproduction, with healing. It's an unconscious, powerful thing, and it is embodied in our fluids, in our being. And it has a flowing quality, obviously, embodied in fluids. Then, and let me also say that these fourfold things, these are forces that permeate every organ to some degree or another, just that many organs have a sort of a propensity to one of these levels of organization or another. Then there's the astral body, and I know you know these things, but maybe thinking about them as I am trying to in sort of a medical way might be a new thing, hopefully. So the astral body, these are the forces of sensory perception. So clearly very associated with the nerve sense system. They're accompanying feelings, however, and they are also, the astral forces are associated with movement, including contractions, like uncomfortable contractions, which can bring to mind consciousness. You're usually not conscious of your intestines, for instance, until they start to contract, and then you're aware of them. So a certain consciousness that sometimes isn't welcome. And they are embodied in air and have a lot to do, the astral forces have a lot to do with structures that have air in them, like the heart, like the lungs, like the intestines. So, and then there's ego consciousness. That's consciousness of yourself, and also consciousness of death. We're really the only creatures on earth that are aware of our passing away. It could be that animals know right before they die, but in general, they don't contemplate their death as we do. There is, the ego connects us with the larger world, and also it is our connection to the divine. We talk in medicine a lot about the ego organization, which is a little bit different. It's the forces that kind of govern human form, speech formation. It's the part of us that looks out into the world and makes pictures of it. It is the captain of our physiology, and it distinguishes the I from the other. So for instance, there's a lot of ego forces in recognizing that you have an infection, because the idea is that the ego organization recognize it, that there is something that is not I, and that triggers the immune system to start eliminating that not I. So the ego organization is also very much involved in elimination. For instance, bowel movements. There's ego organization involved in that. So anything that is conscious has the potentially of being conscious, but also those things that set boundaries to us. Those are ego organization forces, and very much to do with form as well.
This is really helpful. And of course, like all of us have heard these concepts before, but the way you called them forces and then the way you connected them specifically with different functions of the body, that was super helpful. Thank you. Thanks.
Oh, thank you, Laura. I struggled a long time to understand, because usually it's referred to as the ego, the ether body, and you're like, the body, So for me, it helps to say forces. So in any case, okay. So the vertebral spine also is involved in this fourfoldness. Just trying to find my place here. Sorry. Okay. So and specifically, certainly there are multiple fourfoldnesses to be found in the vertebral spine, but a big one is the ego organization, because the ego organization is that which brings us into uprightness, the uniquely human posture. And when you think about the depths of how important the upright posture is, I think we've all discussed it as anthroposophists at some point or another, but what it does is that as we stand up from crawling as an infant and starts to stand somewhere between 1 and 3, it frees the arms for grasping out in the world and bringing the world to us. It frees the neck, which makes room for an outward encompassing gaze and for speech. And as Gierke puts it, in the thoracic spine, quote, the connection between the eye organization and the body are so profoundly and originally bound up. So the spine. So here's a picture. I mean, this is high, for sure a higher type of ape, because you can see that probably these arms of this creature are used to some degree to stand him up and to grasp for things. But you can imagine with a lower ape that they would not be so useful. Nevertheless, this creature does need, for the most part, those arms for walking, for gait. His neck is horizontal, it's bowed to the earth, and there isn't room. I mean, he's sort of stretching his neck forward, but he doesn't have the room that the human does to form speech, and certainly doesn't have the all-encompassing gaze that, or much-encompassing gaze that we are permitted through this upright posture, ego organization. Another big thing about the spine, including the uprightness, is polarities. Now, polarities are always a spiritual principle. They're mentioned again and again by Rudolf Steiner, and whenever you hear it, it's something spiritual. So there are many in the spine. One of them is lordosis and kyphosis. As you can see in the cervical spine, it kind of turns toward the front. And then in the thoracic spine, it goes toward the back, our kyphotic movement. And then in the lumbar spine, again, it moves toward the front, another lordotic movement. Usually in the lordotic positions, neck and lumbar spine, there's not as much movement. There's some, but not nearly as much as there is in the middle, in the kyphotic area. That's if things are held in balance. The big thing about polarities is things have to be in balance. When they're not, there's trouble. If you look at the thoracic vertebrae, which are kind of typical, you'll see that the center part, especially in this superior view picture here on the right-hand corner, it's quite heavy and bulky. And it's winged. It has these wings that come out. And actually in every view, you will see the bulky body, the vertebrae itself, and then these wings, the facets that come off the sides of it. And this is some indication, it reminds me actually of a Gothic cathedral where you have this great big heavy central structure and then these crazy buttresses and wing things coming off the sides. So This gives you an idea of a spine, the spine's polarity in this lightness and heaviness. The heaviness being this part. Oh, by the way, this hole here in the right that you can see so well, that's where the spinal cord would be. So it's really an opening for the spinal cord to be protected so much by this heavy mass. All right, so there is this heaviness of the center and this winged lightness of the other. So a buoyancy and a heaviness, which are a big polarity in the spine. Balance is everything when it comes to polarities. So in the Lectures for Young Doctors, there is this following verse, and I'd like to read it. And it refers to this spiritual quality of polarities, which is very true in the spine, but you will find that it applies to many things. In the power of radiance, raise the spirit eye. So the power of radiance is buoyancy, lightness, the wings. In might of heaviness, God's spirit dwells. So that's gravity. Yet shall not power of radiance lay hold of might of heaviness, nor may might of heaviness permeate power of radiance. For when power of radiance seizes might of heaviness, and when might of heaviness enters power of radiance, then in world confusion, soul and body bind each other unto perdition. So Steiner follows this, this mystifying verse by saying, when power of radiance, so again, buoyancy, lightness, lays hold of the might of heaviness, which is he describes as weight, bodily illnesses arise. And a little later in that paragraph, he says, just think of it. The body lives in the divine spirit. If the power of radiance seizes upon the might of heaviness, the human being is wrongly appropriating the divine within him. Okay, there's something to contemplate for a lifetime. But
Yeah. Can you say it again? Can you say it one more time?
Yeah. What Steiner says about it?
Yeah.
Yeah. Okay. So this is in Lectures for Young Doctors. When the power of radiance lays hold of the might of heaviness, and then in parentheses it says weight, bodily illnesses arise. Next sentence is, just think of it, in the body lives the divine spirit. If the power of radiance seizes upon the might of heaviness, the human being is wrongly appropriating the divine within him.
Wow.
Yeah,
that is a lot to think about.
It's one of those 20-year verses, but I think it applies so well to the fact that the spine needs this polarity between heaviness and buoyancy. And when it is confused, then there's trouble, then there's illness. So let's finally move on to the spine. I'll talk a little bit about osteogenesis, which is how bones are formed. Bones are actually preformed. In cartilage, they are elastic and flexible. Cartilage is an organic substance. It's chondroitin and sulfate, and it's made of an amino, which is a protein, and a sugar. So galactose is the sugar, amino is the protein, and silica is the mineral. And then calcium and mineral deposits are put in later. Silica and calcium are basic polarities that have to do with the spine and with bone in general. Silica is actively involved in osteogenesis, and the beginning of bones, of course, occurs in the unborn child. Silica really doesn't become part of the bone mass once you can see it, but it is responsible for giving it form, meaning once you can see it outside of the mama. Form, and this is again Gerke, form is a non-physical quality which merely becomes visible when filled in with matter. Okay, there's a big anthroposophic principle. Form, or any spirit, when it comes to rest, is matter. But in the movement of becoming, it's spirit. So silica comes from the cosmos. It comes from the periphery. The amnion of an unborn child is chock full of silica, which is radiating from the periphery. We find it in adults in skin, which is a boundary tissue. And remember, boundaries have to do with the ego organization. Remember what it does in terms of immunology. It sets the boundaries. This is me, this is not me. So that's someplace that it's very strongly ego organization related. In the infant, though, the unborn child, what happens is the silica rays into the eyes, into the substances that eventually will become bone. It is, and as it comes in, interestingly, if you were to watch a progressive ultrasounds or say CAT scans of an unborn child, not that you would, but if you did, what would happen is that you would see first that it's all cartilage. The cartilage starts at the periphery. The hands first get formed, then the forearms, then the upper arms, then the shoulders and the center of the body, and the same thing with the legs. When that area, which is now the matrix of the bone, becomes ossified, which means that calcium and other minerals join it, then that goes from the center, the chest, then to the shoulders, then to the upper arm, then to the forearm, going from the center to the periphery. So one is a spiritual cosmic force coming in from the periphery. The other one makes it more earthly and comes from the center to the periphery. So this is silica. As you can tell, I borrowed this picture. It has all kinds of little whirlies in it. But as you can see, it's transparent, or at least translucent. It grows, as we all know with quartz. It grows. It actually increases in size and maintains this magnificent hexagonal shape wherever you look, wherever it hasn't been injured. So very different from calcium. Okay, so silica and calcium, the polarity is buoyancy and weight. Calcium and other minerals are inorganic. They add heaviness to the bone, but also brittleness. It's much easier to break an adult bone than a child bone, because the child still has a lot of cartilage in the bone, which is elastic and plastic. The minerals fill in the matter of the form created by the silica and organic substances. In osteoporosis, which we really will discuss in a minute, calcium levels are low, but replacement of the calcium will not help, because the problem isn't no calcium. The problem is lack of form. More filler isn't going to fix it, as we're all finding out in medicine. This is calcium. It's an entire hill of calcium. And you can tell, even though this is a broad, long shot here, that calcium does not have much form. It's kind of roundish and kind of many-sided, depending on which piece you find. And it's very dense, very opaque. So what happens with osteoporosis? With advancing age, the bone matrix, which now is the living substance in the bone, that's what bone matrix is, it starts to dissolve. The organic substances retreat, and it leaves mainly mineral substances. But most of the matrix goes away. And the vertebral bodies of the thoracic spine get lighter and lighter, so the buoyancy overwhelms the gravity, and the bone becomes more and more fragile, like this. On the left, you have normal bone with matrix. On the right, you have osteoporotic bone. It's important to say here, too, with osteoporosis, that in areas of the body where you are actually bearing a lot of weight, for instance, in the hip, in the heel, in the spine, there's areas carry weight. And there, the bone is constantly remodeled. It's constantly responding to form and also the local pressures to try to increase, to make the best bone needed for the spot. So it's a constant process, and what is going on is that there are cells called osteoclasts which take out the bone, scoop it out, resorb it, and other cells that come along and place new bone in just the right form that is needed. And in osteoporosis, this process continues, but the scooping out far outweighs the laying down. So it's not as if the old process aren't going on. They are, but they are faulty. They are imbalanced. The polarity has been lost. And this is what happens in osteoporosis in the vertebral spine. You can see the upright human being here. Then there is more loss. You see how the neck is flexed, so you're losing your ability to look out in the world, and you're also losing a easy access to your larynx and your speech organs. And not only that, but you're also losing, do you see now this rib cage eventually as the spine collapses with all the fractures, the rib cage is literally sitting on the pelvis, which means that the organs of the abdomen are being compressed. So it's difficult to have good digestion. It's difficult to eat well. It's difficult to breathe well because all of this has ruined that a magnificent ability to expand and contract the ribs and the spine. And it's difficult to walk well because your view is no longer head, but it's kind of down at your feet. So osteoporosis is indeed a physiologic process. It occurs in all of us. Slight women, slight light-colored women, white women get it first, but by the time time progresses, eventually the most brawny and males also become osteoporotic. So it is in that sense a physiologic process. Everybody gets it sooner or later. But there's also an aspect of it being an illness in the sense that all of this compression leads to a lot of other problems. It's difficult to breathe. Your heart barely has room, your breathing hardly has room, and your abdominal organs hardly have room. So what happened to the tissue mass? As I said before, there is a faulty loss of the preforming. There's an absence of organic substances, and the silica process, which gave bone elasticity and resistance, is gone. Now, form belongs to the ego organization. Again, this important principle, form precedes matter. Matter just fills in form. So in a way, osteoporosis is a kind of excarnation. It's abandoning of the elastic organic life and replacement of this, well, there is no replacement. It's just that there's only mineral left. And there's this loss of this form-guiding ego organization. This affects mainly the vertebral spine, by and large, but it also infects the long bones most stressed by this, this laying down of new bone and scooping out of the old bone, especially in the hips, the radius, at the wrist, and in the heel. So what can we do? Actually, preventing osteoporosis should start early. And the idea is to try to slow the excarnation. We are indeed all slowly excarnating, all losing our organic life substances. But willed weight-bearing activities are a tremendous help in slowing this process. So how do you bring in the metabolic limb process? Well, you move them, but you can't just move them. Not any movement will do. It has to be re-engaging the astral activity, which is associated with movement, by giving it a conscious resistance. So moving with weights, actually, either weights that you carry when you run or walk, weights that you lift, all those things that give the astral organization the experience of resistance against gravity is this force that has to be created. And there is the reason it's not enough, and this is true in many ways. It's not enough to say, well, I walk a lot at work. There's a difference between walking around because you're doing other things and consciously willing a and activity. And there's where the ego organization is involved, is when there's a conscious willing in order to do this. So all of these things help. It has to be willed, weight-bearing activities which resist gravity, in a sense, what that does is actually strengthen all the willingness of the ego organization to remain connected with the bone. There are also remedies which I'd be happy to discuss, but I think this, without this, this is the big treatment. So I just wanted to review some principles because I think it goes wider than osteoporosis. We talked about the threefold humanity, the fact that the three realms of organ systems reflect the goal of they not only their goals, but also the unique human attributes that are related to everyone. And how the fourfold humanity brings us into this invisible spiritual forces which permeate us. And really this is where anthroposophic medicine works. Their influences, the influences of the fourfoldness, can be read in our physiology and illness. And that's the basis for anthroposophic medicine, is trying to figure out what happened to the fourfoldness, what aspect of what is wrong can be seen as a pulling away of one of the fourfold members. The other two important principles, I think, are the idea that polarities are spiritual principles. They occur repeatedly in the created world, and Steiner will give you oodles of examples of this. And this overriding principle that spirit precedes what eventually comes to rest in matter. So these are my sources, and I'm happy to take any questions.
Yeah, wow, thank you. I mean, again, I'm just amazed by the depth of wisdom and how it just rolls off of your tongue. And same thing with David Gershon. Last time I was like, whoa, where are you taking us so deep right here? So thank you so much for that. And let's open it up to questions. I had a couple thoughts and I want to see what comes through from others. So if you can just type your questions into the Q&A, that'd be great. If it's easier for you to use the chat, that's fine too, whatever works for you. And I wondered if you could go back to that last slide so we can all kind of look at that one for a little bit on those overarching principles. I thought that was really helpful. I think while we're warming up, I had this question about, I was watching the posture change in that, I mean, that was remarkable to see, but I couldn't help but think of how everyone is just so face down right now with their technology.
Oh, I know.
Like, yeah. And it was just like creating this picture and this idea of excarnation, and like, I don't know. I don't know if you were seeing any connections there and how that posture is just coming in and through a different thing. It's coming in through, like this. So I don't know.
Yeah, that's a very good thought, because it is exactly this flex posture. It doesn't end with your neck, it's all combined. So then your back starts to bow down and your shoulders are pulled into it. And so it's something that we, with time, you will see this. You'll see, some of those adults we were talking about with their rigid posture, they don't have osteoporosis. They may not even have osteoarthritis, but what they do have in many cases is a habitual posture that is changed exactly from the things that you're talking about. And it leads to a rigidity, and it leads to making it more difficult for you to be penetrated by with the full force of the fourfoldness. As I think that might be a reality, maybe something for us to think about. I think I'll sit up a little straighter right now.
I know, me too. I think everybody's probably doing that with us. They have these little devices you can get now that they stick on your back, and when you start to go down, it like it like gives you a little vibration sensation to help you sit back up. Like it reminds you as soon as you slouch to sit back up. So interesting. One of my friends is actually a Waldorf kindergarten teacher. She got one of those for herself for when she's at home, and she just puts it on so she stands up. Interesting, right? Yeah,
I mean, such a gift to be upright. And,
it really is.
just think of all the possibilities, the human possibilities that were put into that wisdom. I mean,
Yeah.
it's really amazing. So.
Yeah, exactly. Okay, I do have a question, actually from David. Does therapeutic eurythmy offer help for osteoporosis and like, posture problems that come with
Absolutely.
it?
Yes. And thank you, David, for asking. I have the sneaking suspicion you know the answer. So anyway, but I would say absolutely, because it fulfills so many of these criteria. It is a conscious activity. It is willed. It is conscious. Those speak to the ego organization. And of course, there can be now, there should be something against resistance, but that's also possible in eurythmy. And so, because the idea is that you bring in the astral body, if you make it conscious, not the body, but the force has to perceive the resistance. That's the way to sort of draw it in. So that force. So yes, I think there are a lot of possibilities there. It has so many of the qualities we're looking for.
Okay, that's great. I have like 3 more questions right now. So I'm going to go with the next one, which is also about eurythmy from Michelle. She's saying, can you speak to how eurythmy works in our fourfoldness, and does it help us in our form, and how does that manifest, I guess she's asking. So eurythmy and fourfoldness.
Yeah. So I'm certainly no eurythmy expert. So my answer will be poor compared to a lot of people. But I would say, one of the things that eurythmy does that no other kind of movement does that I know of is use the backspace, this space behind you. And there's a lot of pulling from the back, drawing things from your back. The backspace is the space of the unconsciousness. It's a space of, rather the subconscious. It's a space of the spirit behind you. And so I think that quality of bringing in the spiritual into our movement is very much an ego organization quality. So that certainly on that level, the physical level is pretty obvious. Also, there is a lot of eurythmy that uses rhythms, the walking rhythms, and walking and doing something different with your arms. I mean, that is all has to do with rhythms and contrasting rhythms that speak to our rhythmic system. So that would be threefold. But I would say, yeah, and I think the real thing that it brings, as far as I know, is this ability to evoke the spirit.
Great, thank you. Okay, here's a more specific question, 2 more actually. What is, Elaine is asking, what is the role of body part replacements? She's saying she had a left knee replacement and then a right hip replacement. Can you talk a little bit about replacements?
Replacements, of course, then you don't have bone being worked on, but I don't know much about what covers the replacement over time. I think it's mainly connective tissue. But also, interestingly, replacements, the one thing I forgot to say about silica is that silica not only is present a lot in our skin, but there is a fine network throughout our entire beings of silica. It forms our interstitial space everywhere. It forms like a scaffolding inside of us of silica. And I can imagine that when you had a joint replacement, that silica network would then also include and uphold that replacement. So it may be, you know, it certainly isn't going to be incorporated into the bone per se, but it may be incorporated into this forming process through the upholding of that silica network. That's a guess, but it came to mind.
Okay, good. Well, the next question's about silica, and I sort of have a question with this. So I felt like you said something about calcium before. I feel like everybody says, oh, take calcium or eat Tums or drink milk or all these things related to calcium. But so I was wondering if you could talk about calcium. And then Fiona is saying, do you use silica to treat osteoporosis, and how about other remedies? So she's asking more of a remedy question, but this
Sure. I think the idea of replacing calcium, unless you're truly calcium deficient, which people can be, but for the most part, treating osteoporosis with calcium is kind of going out of style because of the fact that the calcium doesn't go to the bone. It ends up mostly in tissues where it's not appropriate, like in the arteries. There's a lot of calcification in arteries because, as we said before, what's missing is the form. So using calcium, you'll find there's more and more withdrawal from that idea in medicine. I'm talking about conventional medicine, not just anthroposophic medicine. Right. Silica does address the ego organization, and then so silica does have a place in treatment for osteoporosis. There are a couple of things that are used. One of them is silica, usually in combination with another metal or mineral that does address the ego organization as well, phosphorus, because phosphorus has a very interesting relationship with calcium, but we won't go there tonight. But anyway, it is a light bearer. And so again, you know, this addresses this light heaviness a relationship. And also it is an ego organizational remedy. So once again, awakening, empowering the ego organization to become more involved would be the idea of both silica and phosphorus. Remember though, the silica isn't actually in the bone. It is the formation of the matrix, but it doesn't really, if you were gonna rifle through the bone, you wouldn't find it per se. It was the preformer. It was the cartilage that preceded the bone. So I would say that about silica and phosphorus, they're often used. The thing that I'm most familiar with is agaricus, and there are actually studies on agaricus. David, help me with the second name. It's a poisonous mushroom, agaricus. It's the beautiful one that you see in like in German, you know, kind of kitschy kid pictures with the white stalk, and then it's got this red beautiful cap with the white spots on it. Okay, that's agaricus, poisonous mushroom. But it has the ability, I know you've probably heard of bisphosphonates, which are used a lot in conventional therapy for osteoporosis. And agaricus has a similar quality in that it really brings in the phosphorus principle of stopping all the it rebalances the remodeling. So instead of all the scooping out going on, no longer balanced with the laying down, it rebalances that equation. So it rebalances that polarity, and there are studies on agaricus showing that it helps with osteoporosis, and that's what I usually prescribe first. But the weight bearing, resistance carrying exercise done consciously it's clutch. I mean, it's really the most important thing.
Yeah, that's great. I'd never heard any traditional medicine doctors talk about with consciousness, you know, like that you have to bring your will to it, bring your consciousness to it. Don't just stand there with your weights like this or whatever you're going to do. So that's really great piece that you've brought here. Okay, I guess I'll ask any other questions at this point, and we will be sending out the slides. I also wanted people to know that on the Anthroposophical Society in America's website, we have an interactive map that if you click on the doctors, you can see all the doctors all over the country that are part of the Physicians Association for Anthroposophical Medicine. So if you're looking for a doctor to work with, you don't know who's nearby, you can get on there and find different doctors. I mean, that's what I always think when I'm sitting here. I'm like, oh my man, I wish I lived in South Carolina.
Oh,
So I could come over
like
to
that.
here. Yeah, so if people want more, we can't answer all specific questions here, but I think you're getting a great overview. So any other questions? And I think not. I think we're doing great here.
Well, thanks for your questions. They're excellent, you know.
Oh, good. They're doing a great job. Everybody always has great questions on these webinars. I do have one person asking about, I'm not sure what these words mean, osteodoron and
Oh, yes.
scleron.
Yes. Good thought. Osteodoron and scleron. Okay. Was that the question?
Yeah, that's Elizabeth asking that.
Yeah. Osteodoron, I mean, my familiarity with osteodoron is more about calcium and silica balance at the beginning of life, and there's phosphorus in them as well. And it's more a matter of learning to manage mineral, inorganic, and life substances. That's my understanding of it. I don't use it for osteoporosis, but it's I used it with my own children, and I use it with my grandchildren. That is, I asked my daughter to use it with her grandchildren.
Good grandma. Good grandma.
I'm trying to learn my role. But anyway, and it is intended to help with this calcium silica polarity, buoyancy gravity polarity, very important for growing bones. Of course, the children have much more cartilage still, and what you don't need is, whack them with a lot of inorganic substance. So how to organically bring those bones to a point where they are strong and yet elastic. Yeah, so that the main use for that, I think, was on that end of life. And then you asked about scleron. Great question. That is what you asked for, right? Scleron?
Yep.
Okay. So scleron is mellitum plumbum. There are several remedies in anthroposophic medicine. Actually, when you think about it, some of the most useful remedies involve a poison. And plumbum is lead. It's a poison. But it is vastly diluted. I think it's a D8. David, help me. D8, D810, something like that, in the combination with honey. So mellitum is honey, and lead is this substance. And what lead does in this vastly dilute state is that it helps especially your thinking, but also your circulation from succumbing to this calcium rigidifying effect. And it keeps the central nervous system, as well as your liveliness, flexible. I can say that pretty advisedly. My mother is an anthroposophic doctor, and was for years. She started taking scleron, and the lead is kind of scary. I mean, it is indeed a poison. We're worried about lead in our paint and children eating it and so forth. But as I said, homeopathically diluted. She's been taking scleron, I think, daily since she was about 55. And she turned 100 about 2 weeks ago, and she can't hear, but she certainly, if she can hear you, her conversation is cogent and full of liveliness. I mean, so many anthroposophists do take scleron in middle age and beyond, and I can only say that if flexibility in your thoughts, liveliness in your thoughts is your aim, I think it's a pretty special medicine. Lead is also used in other contexts. It probably has a place in addictions because it has sort of a moral quality to it. Also with the organ that it's associated with it, but I guess that's not about this. Anyway, but scleron, yeah.
Okay, wow. Thank you. And thanks, Elizabeth, for asking that. And thank you for addressing those too. That was really fantastic. All right. Well, Let's see. Oh my gosh, there's more. Now there are more questions. Now we have 6 minutes. I'm just going to keep going. Okay. There's one more question. This is about spine. Cheryl Ann is asking, what is the significance of scoliosis in the child's spine? Can you talk about that at all?
Yeah.
Cheryl
So,
Ann.
yeah, scoliosis really comes to play in adolescence. I mean, there may be some scoliosis in a younger child, but the strong changes in terms of the spinous direction is in adolescence. Also a time of great turmoil in terms of what's on top in terms of your fourfoldness. The ego organization is barely even there, except physiologically. So I would say that there is, a lot of support has to be given to the ego organization for those children. And also, again, conscious activity that is meant to address, to try to even out the polarities. So I would love to say more. I know that the adolescence is the time of real changes there. And if you don't mind, tell me who you are, and I will do some research for you.
That's great.
Yeah.
That's great. So email me and I will pass that on to Renee and she can get back to you with a little bit of research on that. Thanks for that. Good question. Okay. I think, are we there, everybody? We've had some great questions that are slipping in, and nope, I think we're done. Okay, wow, that was fantastic. Questions really evoked some interesting conversation there, and the slides are fantastic. Thank you so much, and it's been wonderful working with you, and thank you all for being on the call tonight, and we'll talk to you soon. Thanks, Renee.
Thanks, everyone. Good night.
Bye, everybody. Good night.